Welcome to Make an Impact podcast, where we dive deep into the stories, strategies, and solutions that drive real change. I'm Heidi Fisher, and I work with organisations on a mission to tackle poverty, reduce health inequalities, and create lasting social impact. In each episode, I bring you inspiring conversations with change makers, social entrepreneurs, and thought leaders who are making a difference. Whether you're looking to boost your impact measurement, learn from innovative projects, or find fresh ideas to transform your work, you're in the right place. Welcome to today's episode of the Make an Impact podcast, and I'm joined by Charlotte today. So Charlotte, do you want to tell us a little bit about yourself and what you do, please?
Yeah, so thanks for having me on, Heidi. It's lovely to be here. And I founded an organisation called Beacon Family Services, which is based in Sutton Coldfield in the West Midlands, and was set up to provide therapeutic family support. So there were, when I founded in 2016, around 70% of children in the Midlands, the West Midlands, who were referred to CAMHS weren't getting seen. And of those that were seen for an assessment, they actually didn't get any follow-up. Around about 2/3 of them didn't get any follow-up. So I founded Beacon Family Services to start offering, play therapies. And it really developed, and families found it very helpful. My specialism originally was working with adopted and fostering and kinship families, but the work I was doing with them really resonated with so many more families that were having difficult times and challenges that were really impacting how safe, strong, secure family relationships felt. And actually, they really felt that's what they needed, spaces to explore relationships over diagnosis, because diagnosis wasn't actually helping. So, yeah, I founded that. Since we began, there's always been more demand for our services than either funding or staff. So it's been a long process of finding new and innovative ways to be able to support more families. So we initially began a group model of provision for children and parents that was really successful, and we worked alongside children's centres to do that, and we were able to support more families. And then we started developing resources, self-serve resources for families as well, and that's developed into us launching an app, which is now one of the highest rated apps for children's mental health in the UK, and it's in the early and preventative space. So it's for parents with early worries, because my work is very much about that part of helping families sooner, not leaving them on waiting lists.
Amazing. That stat about the amount of children that were waiting and not getting any follow-up is really scary. I think it would motivate me to do something. So it's brilliant to hear what you're doing. And I love the fact that you've got the play and you've got the app. So you've got two mechanisms to do it. How did that come about in terms of that split between the two? Was this a pandemic activity?
There was definitely a pandemic element to it. Yeah, we work with children and parents together. Traditionally, play therapy is often thought of as you take your child to see a therapist who will play, and through the play, they'll be able to express emotions that need to be processed. But actually, we always work with the parent and child together, because actually a lot of play is about creating connection. And when there's connection in a relationship, there's a sense of trust, there's a sense of safety, there's a sense of I'm okay, I'm capable. So actually, when families hit times when they're struggling, that's a thing that often falls off, the playfulness in relationships. And so we find that where we can reconnect that playfulness, you really strengthen the relationship and that sense of connection. And it sounds super simple when I say that, but actually, as a parent, when you're in a place where things are feeling tricky with your child, it can be really difficult to actually feel joyfully connected and feel the ways you can do it differently. So having someone alongside you to help you can really lessen the load for parents and help them relax into that and see, yeah, actually, me and my child are doing great. I do get my child. I am doing okay. When the pandemic hit, that's the bit that changed. As therapists, we couldn't be in the room anymore. So we started developing some resources for the parents that we were working with. And we developed our lighthouse model, which is the idea that we all want to feel safe and be in the lighthouse or near the lighthouse. But the reality is that we're not all feeling safe all the time. We all move into states where we're a bit more mobilized. It might just be that we've got really hungry. It might be that there's some really difficult stuff happening in our life that we're very worried about. So we move into a state that we think of as struggling, and that's being on the rocks that the lighthouse are on. And you might be sliding into the water and worrying what's going to get you. And hopefully there's someone that reaches out a hand and pulls you back up. But there isn't always. And sometimes then you can slip down and feel very much like you're drowning. And the challenge then is you can't just go from drowning straight back up to the lighthouse. Actually, you need to find your way back up over the rocks and reconnect. And the play activities we use help in that process by providing either just the right amount of structure for a child who needs the safety and security of adult limits and expectations, or increasing the engagement and those moments of shared joy and just being lost in the here and now together. Yeah. Or maybe a child needs some really healthy challenge and to be supported to really feel confident at the developmental level that they're at, to really secure their self-esteem. Or maybe they need some quiet, nurturing play that's just soothing and calming. And we realised that knowing what kind of play and linking it to the state either you're in as a parent or your child is in is the crucial bit of understanding that makes the difference. So yeah, we developed the resources. They were really popular with our families, and so they told people who started asking for them, and we released them as many people did during the pandemic for download. People loved them but didn't like how much ink it took in their printer to print them, and so the suggestion was made to us that we develop an app. And we were really lucky to partner with Clarion Housing through their community fund to develop that app, which has become a resource in and of itself now for families.
That sounds brilliant. It sounds like an amazing journey, and it's fascinating. I love the lighthouse analogy. It's interesting to think of it like that in terms of the steps and where you are around the lighthouse. It's a really simple way to explain what you do as well.
Yes, yeah, these are like really complex ideas that therapists understand. Actually, I'm talking about the nervous system and the polyvagal system and all of this. But actually, as a parent, when you're in a place where you're like, actually, everything is feeling too much, I don't know what to do next, and I need things to be different now. Actually, you don't need a load of theory, do you? You need,
No, definitely not. It's a bit like from my accountancy days where uh, people would come and they want their accounts done and they want a
yeah.
tax return done. They don't want to know what the regulations and rules and laws are around accounts and tax, because it's like they don't
Yes.
care. They just want it done. They want something sorted out, don't they?
Yeah,
Yeah.
absolutely. And that's what so many families need, and teachers and other professionals that work with children. Because I think the statistic is something like 1 in 5 children's got a probable mental health need. And the number of children that aren't able to attend school because of anxiety now. And actually, we know that the NHS is at capacity and isn't going to be able to see and support all those families. So how do we do something to help parents have some of the knowledge that will give them the confidence that actually they can provide what their child needs emotionally and socially?
Yeah, it's fantastic. So, from what you said so far, my brain in terms of impact measurement is going like crazy. I'm like, wow, there's so much happening here in
Yes.
terms of impacts, for the children, for the parents, for their schools, for their life, how they socialize, everything. I can like I would be like, oh my God, this is just it's getting bigger and bigger. The ripples just keep going and going. With that in mind, that there are so many different impacts that your work has, how do you actually measure it? This is the
We,
golden question.
yeah, the golden question. So I suppose when we started, we counted things like the number of people that we saw. But actually, one of the things that we have always done is use some outcome measures. So we find different ways to ask parents and children when we first see them how things are. And then we take a measure of how things are at a later date. And that's given us really good information that actually we 100% of parents that have engaged with us have experienced change and difference. We haven't had families for whom things get worse. And it's also because we've used psychological measures, given us really helpful information about how things shift and change. So, one of the things we've learned in our work is that what often happens is parents feel an increase in closeness with their child as a result of our support and a decrease in conflict in the relationship. So that's one of our measures. And we've recently finished running a trial of subscription packs where we had 200 families who received a pack of our resources every month for 6 months through the post. So something lovely arrived for their
Amazing.
child, yeah.
What a great idea.
Who was excited, and they got an email explaining some of the thinking and the theory behind it during the month as well. And of those families, we had 82% had an increase in closeness, and 71% of them had a decrease in conflict. And then there was about 16% of families for whom things stayed more or less the same. So yeah.
That's amazing that even just with posting something out to somebody, it's still making a difference. And
Yes.
you actually it shows that it doesn't have to be that in-person mechanism at all. You can just by showing and sharing something with someone, you can actually make a huge
Yes.
difference. It's
Yes.
like what this needs to be in everywhere. Every parent needs this.
Yes, yeah, absolutely. And every parent can download our app Lumin&us, and I will make sure that there's code for people to download and have a go with it. Um, but your question about measuring impact, there's that part, but actually you're picking up on the really hard bit is that we're talking about relational change. And sometimes that's really hard to measure in a precise way. So we've actually got a new project going on currently that we've got a resident artist with us for a year. So he's funded by Eastside Projects down in Digworth, and Marley Starsky Butler has a background as a social worker and a creative artist. So he is present in and around the business, the staff, the families, just observing for a year what goes on, and we'll produce a piece of art and we'll have an exhibition. We haven't commissioned him to do something in particular. We haven't said make sure you take lots of lovely photos of everyone having fun. We've just said be with us and see what you see and tell the story. So that's another way that we're trying to measure our impact.
That's lovely. I love those kinds of things like the live scribing and that kind of
Yeah,
activity, the photography, anything like that. I think they're brilliant ways for people to be a little bit more creative with their impact and how they communicate and share it, definitely. And you see it visual in that it's not a boring 100-page report.
absolutely. Where we do, and it's really difficult because we can't always share images of what happens in our sessions, but we do have a number that we do share, and it is really that's how you understand the impact is when you see a parent and child lost together in a moment of play and fun, and sometimes how tricky life has been for them in the run up to that. That's the real win.
Yeah, definitely. I think that's a really, really useful idea for other organizations to use as well when they're thinking about how they share their impact. I'm always saying it doesn't have to be a report, but it's
Yeah.
good to hear that you're actually doing something practical about that. I hope we don't have to wait a whole year to see something though. I'd be like, I want to see something now. I'd be too impatient.
I know I'm having to be really good as Marley's about this, introducing him to everyone and letting him get involved and not say, have you got anything yet? What do you think?
The artist's muse, which is like
Yeah,
it hasn't come through yet.
yeah.
Yeah, definitely. We talked about some of the ways you are measuring your impact. Have you found that there are any challenges or around measuring impact or things that you would like to measure that you haven't quite figured out how to do it?
Yeah, I think the part that we are really keen to develop is an understanding of we know we have an immediate impact for families, but also for organisations like the NHS and like our local authorities who are involved in funding us, actually they really want to understand the longer term value. And I think really developing longer term measurement of families that we can start seeing what's the impact now, but go back to at a later date. Because I think ultimately, and this is the sort of thing I'll ask you for help with, ideas, it's then thinking about what's the cost savings.
That's
Yeah.
one of my geeky things, as well
Yeah.
as trying to get people to be more creative. I'm like obsessed with trying to put financial values and find the cost savings. But yeah, it's interesting because a lot of organizations do have that challenge where they're potentially commissioned by the NHS or some other public sector agency or body, and you really want them to share their data on the
Yes.
children and families you're working with. And very often you don't get access to that, but that's a huge part of the impact in terms of how frequently are they going to mental health services, how frequently are they going to the GPs. And whilst you can ask a family for that information, whether it's 100% accurate or not
Yes.
is not always, you're not always certain of that. I'm always trying to encourage that two-way flow of data, and it doesn't always work. But yeah, definitely the more you can get that information, the more you can start
Yeah.
to talk about those numbers, which then will get you more work commissioned, hopefully.
We've recently we're part of an NHS Innovation Accelerate program being run by a number of GP surgeries, and we're in partnership with Froome down in the southwest, who are trialing a couple of apps, one to support adults with wellbeing, and our app Lumin&us to support families. So over the next 2 years, all families who go to their GP in Frome and want to talk about their child will be given an opportunity, and all residents of Frome will have an opportunity to use the app, and we've started data gathering through the app to understand that impact, and we're really hopeful that we can develop really good data from that about what we're seeing and what all those practitioners that work out of primary care are seeing as the presenting issues, because we know that the overburden for frontline staff in the NHS, in schools, in social care is huge. Yeah,
Yeah, definitely. There's talk nowadays about teachers having to be mental health practitioners, don't they? Because they're like the front line seeing it as well nowadays. So
absolutely.
it's very, I think it's a very scary problem when you think about the scale of it.
Absolutely, absolutely. I think if you think 1 in 5 children, that's around 6 children in every class who's struggling. So that's a lot
It's
for each
in
teacher in every school.
yeah, and that number's probably underestimated. I don't want
Yes.
to scare us more.
Yes.
Yeah,
Yeah. Yeah.
definitely.
And the other part of the pressure of that for schools is that we know that the sooner we respond, the better, and that most lifelong mental health challenges are established by the age of 14. So actually, this is properly a national crisis that we need to be finding new ways to support sooner.
Mm. And my brain is like, oh, there's lots of cost savings there.
Yeah,
On the flip side, if we get this intervention in early enough, we're not just talking about the GPs and those kind of appointments where
yeah.
like it's forever
I think I've
ultimately.
got the number that nationally, the wider cost of poor mental health to families, businesses, and the government is around about 300 billion a year,
Mm.
which
Sounds
is
about right. Mm.
just imagine that we could redirect that money to reduce poverty levels for families. That would be huge
Yeah.
in
Yeah.
terms of,
Amazing. That would be, and then we wouldn't get there. We need to cut costs. We need to cut back services. I
yes,
think with we where we're seeing all the reduction in the youth services
that,
is again it's impacting children just a little bit further on in their journey. They're not in
yes.
primary school, they're in high school, and there's no support for them either, which
Yeah.
is really sad.
I had a trip to the States and Canada at the end of last year to meet professionals and academics out there working to support children's mental health. And we went to visit because actually the UK's one that got just about the lowest rate for children's mental health. We're really struggling. So we wanted to visit a country where things were a bit better, but actually there's still worries. But there were some really key themes that came out from everyone, which was that we really need to invest in supporting parents to be at home and care for their children in those first few years. That's really crucial. And then we really need to invest in good quality childcare so that actually parents have the support for their child that they need and to have the opportunities that they might want to work. But that also we need to really think about how much free play we're allowing children as well at a younger age and really widen out those amounts of opportunities. And it's also obvious when it's said, but has somehow been lost, I think, our policy and yeah.
Yeah, it's a focus becomes on academic results, and you lose that sense of fun and play, don't you? And um,
Yes,
families are focusing on getting enough money to live on, so they're also not playing with their children. Yeah, there's
because
all
they've got to be at work. So yeah, our children getting the good quality care during that
yeah.
time that their parents would have been able to.
Yeah, it's feel very sad now about the state of things for children and young
Yeah.
people. It's not a good situation, but you are going to save them all.
Yes, that's
Definitely.
that's the impact we would like to have, Heidi, is to make a huge difference to children's mental health and their parents, crucially, because I think perhaps that's what's different about us to other offers is that we really see that we've got to start with the parent, that we can't just think about child and a parent's mental health is so interlinked.
Yeah, definitely. You do one without the other, it just goes back to where it was before, doesn't it?
Yeah.
Because, yeah. Last couple of questions for you then. So, what would you say has been the most significant moment for you so far since you started your organization?
I think the most significant moment is some of the children and parents who are still with us and their joy when they share how much it's meant to them to connect and have fun with us. I was with a child this week who really wanted to play in our hammock, something they did when they were much, much younger, and watching them just enjoy being in the hammock and their parent be so relaxed with them was just, those are the kind of moments that really make me feel grounded in what we're doing.
Amazing. So you still get time to actually see the children and parents I think find that quite shocking. Like you're managing all this, you've got all this amazing stuff going on, and you're still getting time to get in there.
Yeah. Yeah, it's long-term relational work that we offer at Beacon Family Services. So yeah, some of the families that I was began as therapist with 6 years ago, yeah, I will still be available to them families don't always, that doesn't mean that a family's having therapy for 6 years, but actually when you've made a relationship with someone who's understood and helped you, when you reach another transition point within your family where actually you might need to revisit some of the conversations, it's really helpful to be able to come back to someone who knew you and gets it straight away.
Yeah, sounds like a good way to do it, in that you've got that trust and established, and it's just there,
Yeah.
isn't it, as an ongoing thing. What um do you want to focus on doing next?
So, what I want to focus on is really getting our app to as many parents as we can, to as many professionals as we can, to really make them feel supported in using play and building relationships. And yeah, talking about how it feels to be struggling or drowning and what helps get you back to feeling safer again.
Amazing. Yeah, you need a whole set of ambassadors across the country promoting your app.
We
Yeah,
do.
yeah.
We've
Just to
recruited
add to
you,
your
Heidi.
just to add to your to-do list. Yeah, I'm
Yes,
the bod over this part of the country now. Yeah.
yeah,
Um,
absolutely.
so is there anything else that you would like to share with anyone that's watching or listening?
Shall I share some details of where to find us?
You can do.
If you're interested. So, if you're local to the West Midlands, then our website, Beacon Family Services, so it's beaconservices.org.uk, has loads of information. You can get on as a professional, as a family, or as a funder to learn about us and what we do and what we've got on offer. And if you're interested in our app, then you need to head to Luminous Family Wellbeing dot let me find that one, luminousfamilywellbeing.com, and you can find out all about the app, which you can download straight from Google Play or App Store. And we're a social enterprise. So there is a completely free version of the app that is always available because we strongly believe that any family that's in need shouldn't have to put their credit card details in to get some support. But to sustain an app that is, yeah, really going to be as supportive as it needs to be, we also have a subscription model, but you can sign up for a free trial with our code, which I'll give you.
Fabulous. Thank you so much. It's been so good talking to you, and I love what you do. I've known you for a number of years now, and it's nice to see that journey, and also just to hear you sharing about it. We don't often talk about it. It's just you're just naturally doing what you're doing. So it's really good to talk to you
Yeah.
and find out how much you're actually doing, which you're not sharing with me every week.
Yeah, I know.
Definitely. So thank you so much for joining me today.
Thank you, Heidi. It's been great to be here.
Thank you for joining us on this episode of the Make an Impact podcast. I hope you found today's conversation as inspiring and thought-provoking as I did. If you enjoyed the episode, please subscribe, leave a review, and share it with others who want to create positive change. You can connect with me on LinkedIn and learn more about my work at makeanimpactcic.co.uk. Until next time, let's keep making an impact in the world.